the med school of 2040. I'm standing on orientation day beside 50 brand new medical students, and the rite of passage isn't a stethoscope or a white coat anymore. It's a slim badge that each student gets and clips onto their coat. Inside it lives Escalapius One, a personal AI tutor that boots up by asking for a pulse reading and a 10-minute self-interview. Its main purpose is to learn everything about the medical student, their background, their learning styles, maybe they're visual thinkers who hate mnemonics and love spaced repetition, their study and sleep routines, everything. It's assigned to each medical student to help them become the best doctor possible. It then says,
"Hi, Aria. I'll be your tutor, sparring partner, and a second brain. Let's start where you're strongest, pattern recognition."
And build outward. Adaptive tutors aren't just hype. A 2025 multi-site study showed generative AI dashboards improved exam scores by 14% when they adjusted for pace and modality to each learner's cognitive load curve. Hi, I'm Dr. Dave. I talk about AI in medicine, and in this video, I cover different scenarios that a medical student might experience in their journey through the medical school of 2040. Number 1, Anatomy Reimagined. Week 1, Aria steps into a mixed reality theater. With one pinch, the hollow human cadaver blossoms, vessels throb, lungs breathe. Because Escalapius One knows she struggles with spatial resolution and rotation, it dissolves the pectoralis into a translucent origami and tilts at 90 degrees until she nods. Next scenario, it shows the physiology of a pulmonary embolus and how it travels up from a deep vein thrombosis, lodges into the pulmonary arteries, and suddenly one side of the lung becomes blue, indicating hypoxia. Now, anatomy and physiology are not just words you read in a textbook, but are concepts to interact and play around with. And this is something I struggled with in medical school because I'm more of a visual learner. Only really learned physiology of heart failure when I started seeing patients with heart failure. And before that, I struggled to form a real concept of what heart failure looks like during my pre-clerkship years. So mixed reality, anatomy, and physiology isn't speculative. A 2024 randomized control trial found VR anatomy cohort scored 18% higher on retention tests than those using 2D atlases. Now, GigXR's platform, which is already in 26 universities, lets instructors overlay real-time physiology solvers onto that hologram, so a simulated pulmonary embolism, for example, turns half the lung field cyanotic. Number 2, synthetic souls and bedside manner. So by October, our med student Aria, she meets Mr. Reyes, a vaccine-hesitant avatar built on the PCS Spark. The LLM beneath him escalates to frustration if Aria lectures or softens if she mirrors his feelings. After each encounter, Escalapius One scrubs timestamps, eye tracking data, word choices, and then replays 2 teachable moments to Aria. He says, "Notice his micropause after you said herd immunity. Lead with a question next time." One of the most important things I learned through medical school was how to have excellent bedside manner. And we were lucky to get patient exposure in our first year of medical school, allowed us to develop a longitudinal relationship with our patients and actually learn and grow with them, which was, I think, my favorite part of medical school. PCS Spark's pilot at 4 US medical schools shows a 26% jump in students' empathy scores on the Jefferson scale compared with standard role play. A Nature Digital Medicine study last month reported chatbot answers seeded with chain of thought prompts were rated more empathetic than physicians' EHR messages in 31% of oncology queries. Number 3, the digital twin ward. Second year physiology moves to the cloud ward. Each tablet hosts a different digital twin of a real patient, characterized through parameters of imaging, genomics, and even wearable derived sleep stages. Aria orders 2 liters of saline. The twin's wedge pressure spikes and the hollow lungs begin to gurgle. Escalapian One pauses the simulation and launches a 90-second micro lesson on the Starling curve. Because it learned she retains hemodynamics best when she sees the blood flow, not just the equations in a textbook. Digital twin pedagogy is maturing fast. The University of Virginia's 2025 trial showed diabetic trainees using twins improved artificial pancreas tuning and cut the HbA1c score by 0.2% when compared with controls. Systematic reviews likewise highlight twins' value in pediatrics and preterm neonatology, where real patient experimentation is almost impossible. Number 4, OSCE 2.0. So this is assessment without clipboards, final semester. Aria confronts a virtual OSCE exam. Whisper transcribes, and a fine-tuned LLM grades each rubric line. History, differential, empathy, achievement kappa of 0.87 versus faculty consensus in a 2000 transcript study. Escalapius One shadows the examiner, tags why points were lost, and cues flash scenarios for the next morning for Aria to learn. Feedback that once took 2 weeks now lands in 2 minutes. 5, case day. The code blue that never was. On night float, Aria sees a real postpartum hemorrhage patient crashing. Aria's muscle memory, shaped by hundreds of in silico rehearsals, fires. A massive transfusion protocol, uterotonics within 45 seconds, patient thankfully stabilizes. At 3 a.m., Asclepius 1 quietly vibrates her badge, tells Arya,
Excellent save. You hesitated 4 seconds on TXA. Let's run a 60-second micro scenario after breakfast.
Number 6, Faculty 2.0, humans as orchestrators. Professors are not just the teachers of rote knowledge now, but instead they curate scenario libraries, audit AI feedback loops, and run Socratic debriefs, ensuring that the tech anchors back to humanism. One ethicist even jokes at this time, we grade the why behind the AI's what. Research from Toronto shows faculty hours spent on low-level grading dropped 42% after LLM OSCE adoption, time that was reinvested in mentorship, which honestly played the biggest role in my career to becoming a better doctor and advancing my career. 7, adaptive knowledge engine, how it all runs. There will be multiple layers that go into Asclepius 1. This includes multimodal streams, learner profile vectors, generative scenario engine, mastery graphs, and privacy guardrails, of course, for on-device encryption and federated updates. What these do is that you'll get AR meshes, vitals, voice, and gaze training that can build moment-to-moment cognitive load map for each medical student. You can have learner profile vectors, which background, education levels, pace tolerance, which predicts the zone of proximal discomfort for each medical student. Curriculum goals and gaps can be put into a generative engine, which then can craft bespoke cases on demand, Sora-style video if you need. Mastery graphs, with every click and hesitation, you can ingest that into a model, which then triggers spaced repetition, bursts hours before predicted decay. Essentially, creating a more adaptive platform to learn. And privacy guardrails are of course essential to ensure that everything that's learned about the medical student is kept local and only gradients leave the campus, which only marks leave the campus. And number 8, prototype 2040, starting in 2025. Number 1, I think medical students should start to issue personal AI licenses. Start with chat style feedback on SOAP notes, which we write so many of. The cost would be $40 per student per year. Number 2, you can adopt digital twin electives. Medical schools can license cloud simulators that run $10 an hour, cheaper than one live pig lab. Number 3, pilot LLM scored OSCEs. Begin with communication stations where rubrics are explicit and the faculty are also physically present to verify edge cases. Schools that followed this roadmap in 2024 actually saw a 19% jump in first-time USMLE pass rates and 15-hour per month reduction in instructor grading load. I switch off the holoprojector. Now the auditorium reverts back to its white walls. Somewhere in Asclepius 1's solid-state memory, a curriculum unique to each code batch medical student is evolving in real time. So when a high school senior asks me, Doctor, what will the med school look like when I get there? I smile and I say, you'll never study alone again. Your first patient might be code written in the cloud, and your next patient might be me, who's grateful that you learn on the safest canvas imaginable. Because by 2040, medicine's most powerful teacher won't be a human or a textbook. It'll be a mirror-bright AI that learns you first and then illuminates the universe of healing through your own eyes. Follow for more AI and medicine content.